historic day, and it would not have happened with all of the cooks that were in the kitchen. And the cooks that were in the kitchen, you know who you are. You know, hopefully we will give hope to some of our sisters in some states who, you know, we just have to have a moment of silence for the ignorance run rapid with regard to women's reproductive health. So thank you very much. This is great, and it's the law. Today, the governor signed AB 2348. Our Women's Reproductive Rights Bill, the first bill in the country that will allow registered nurses to dispense hormonal contraceptives. It's a big deal for California because it cements our position as leaders in protecting women's reproductive rights. This bill received some opposition, but as the governor said, it was the right thing to do, so we're thrilled that he signed it. If you do a Wikipedia search on war on women, over 1,100 pieces of legislation have been introduced across the country trying to turn back the clock in terms of rights that all of us in this room know that we are entitled to. So once again, California is at the forefront.
The bill that the governor is about to sign into law today will strengthen California's commitment to ensuring that every woman has access to quality medical care that respects her ability to make her own medical decisions that affect her own body. Across the country, reproductive freedoms have come under fierce assault, whether it's Republican Senate candidates like Todd Akin questioning what is, quote, a legitimate rape, to the Republican House-led hearings on women's health issues, where they failed to invite a single woman to engage in the discussions, to the bare-knuckled attacks that Planned Parenthood has faced across the country. Women are being forced to defend basic rights that have been theirs for decades, and we've seen unconscionable rhetoric that has no place in civic dialogue. That's why I'm standing with my colleagues here today who are refusing to allow this vocal minority to turn back the clock on women's rights.
You know, all across the nation, reproductive health and healthcare providers like Planned Parenthood are under attack, unrelenting attack. Over 1,000 bills have been introduced to restrict access. But today in California, we made history for us and for the rest of the country. Yesterday I was in New Orleans at a national meeting. Everyone knew about our bill. We are the only piece of legislation that is going to a governor's desk and is going to be signed. And out of 1,000 that have been introduced across the country in the last 2 years, 1,000, what is that about? So we really are blessed to be here today, and we at Planned Parenthood feel blessed to have our coalition partners who stood by us every inch of the way, and our elected officials who understood why they needed to make a stand on this issue and a stand here in California. You know, Holly Mitchell, as our author, was kind of a no-brainer because I've known her for almost 25 years when she worked in the legislature for Senator Watson. And I have to tell you, I know she's one that when she cares about something, she will do everything, and I mean everything within her power to make it happen. And she cares passionately about women and their families, and she cares about it not just for health care, but for jobs and child care, all the things that really matter to women. Holly's there, and we're fortunate that we have her leadership in California, and I'm really grateful that I had her support and agreement to author this bill.
The fact is, California is the pace setter. We're the pioneers. Today, we're protecting women's health, and instead of shrinking back and trying to take away women's health care services or birth control, we're empowering women, and we do it proudly. So here we are, going counter to the trend, and sometimes it's not comfortable, but the fact is you have to have part of society kind of holds back, and another part of society has to advance, and together we keep things moving. Well, California is the place where we advance.
California is in the forefront and will continue to be in the forefront of fighting for the reproductive rights and health access rights for women and girls. That's why I ran for office, so today is very, very significant to me.